In this video, we'll learn about menstrual cycle. What exactly is menstrual cycle? What is the duration of menstrual cycle? What are the different phases of menstrual cycle? Remember, we named the different phase of menstrual cycle depending on whether the changes happen in the ovary or in the endometrium. And also there are changes, remember, seen in cervix, vagina, and hormonal changes are also visible. And little bit applied aspect also we'll see in this video in relation to this topic, menstrual cycle. What exactly is a menstrual cycle? Okay, before we understand what is menstrual cycle, we'll see what is menstruation. Okay, the periodic discharge of blood along with cellular debris from the female genital tract is termed as menstruation. So remember, whenever we tell menstruation, it is not just blood. Okay, along with that, cells also will come out. So together we call it as menstruation. So this cyclical changes occurring from one menstruation to the next menstruation, we call it as menstrual cycle. So, for example, today is the day of menstruation or the bleeding starts. Remember, only the discharge of the blood and cellular debris we call it as menstruation. But the changes which takes place following that for the next 1 month, no, we call it as menstrual cycle. It is, why do we get a menstrual cycle, or what is the significance of that is it is regarded as a periodic preparation for fertilization and pregnancy. Assuming if fertilization happens today, the endometrium should be ready to implant, right? So that is the preparation the endometrium regularly undertakes, so that if fertilization happens to continue the pregnancy, the endometrium should be ready. That is why these changes regularly takes place. So the normal duration of menstrual cycle, in a normal average duration, is around 28 plus or minus 4 days, meaning 28 minus 4 is 24 days up to 32 days. So 24 to 32 days is a normal average menstrual cycle. Okay, that's a duration, but it can vary from 20 to 45 days. It can vary from per people to people, but majority or an average, the duration of menstrual cycle is 28 plus or minus 4 days. Before that, before we understand menstrual cycle, let us just understand these terms, okay? Menarche and menopause. A woman's first menstruation is termed as menarche. It occurs around the age of 12 years in a female. The end of woman's reproductive phase is called menopause, that occurs between the ages of 45 to 55 years. For 1 year, if there is no menstrual cycle, we usually call the female as attained menopause. Now moving on to phases of menstrual cycle. Remember, there are three phases: menstrual phase, proliferative phase, and secretory phase. Remember, now these phases are in relation to endometrium we are talking about. Okay, so the first 4 to 5 days, what happens is there's a menstruation, the bleeding which happens, right? That is called as menstrual phase. So what would have happened is the endometrium layer has come off. So the next few days, what happens is whatever the endometrium has fallen, it will start proliferating back again. That's why we call it as proliferative phase. So the endometrium is in a stage of proliferation. After few days, now what happens is all the glands which proliferated, no, they'll be filled with secretions. That's why we call it as secretory phase. So throughout 1 month of menstrual cycle, or one cycle, what happens is first few days there'll be menstrual phase, followed by that there is proliferation of the endometrium, followed by proliferative phase we have secretory phase. Now in the bracket you can also see follicular phase and luteal phase. Okay, so whenever the proliferation is happening in the endometrium, same time the follicles will be growing in the ovary. That's why we also call it as follicular phase. Okay, secretory phase, when the secretions are continuing in the endometrium, in the endometrial glands, the in the ovary, the follicles would have converted into corpus luteum. That's why we call it as luteal phase. So you can just understand here, what I was trying to tell is when I tell menstrual cycle, remember the changes will happen in many different organs in a female. Okay, one of them is uterus. The uterine endometrium changes will be happening at the same time. Ovary also will be, there'll be a lot of changes which happen in the ovary. Mammary glands also, remember, there'll be changes which takes place during the menstrual cycle. This is the cervix. Okay, the lower end of the body of the uterus, we call it as cervix. There'll be changes in the cervix also. Vaginal changes also will be seen. Other than this, hormonal changes and the body temperature also changes throughout the cycle. So these are the changes you need to explain while answering this question, menstrual cycle. So first, we'll just see what are the changes which are happening in the endometrium. Clear? Endometrial cycle, otherwise also called as uterine cycle. In the first day is nothing but the day of bleeding. When the bleeding starts, no, we call it as day one. That is the day one of menstruation. So this phase is called as menstrual or bleeding phase. It ranges from it will usually be up to 4 days or 5 days. Followed by that, from the sixth day onwards, the proliferative, it is called as proliferative phase. It is mostly because of the effect of estrogen. And after ovulation, ovulation happens around 14th day. After the ovulation, we call it a secretory phase. Clear? So now I'll just take the whole menstrual cycle as 28-day cycle. This is an average, I told you, right? 28 plus or minus 4 days is the average duration of menstrual cycle. So now if a female has a 28-day cycle, remember, first 5 days when the bleeding is happening, we call it as menstrual phase, otherwise called bleeding phase. From the 6th day onwards till the 14th day, it is proliferative phase. 14th day ovulation happens. For after the ovulation, the the next 14 days we call it as secretory phase of menstrual cycle. So now, during the menstrual phase or bleeding phase, what exactly happens? As I was already mentioning, the menstrual blood actually consists of the blood, mucus, the sloughed endometrium, meaning the cells of the endometrium, and unfertilized ovum. All this will be coming out through the menstrual or bleeding phase. See, this unfertilized ovum, like very few people only it will be there, because 14th day ovulation happens. Okay, don't get confused with this. Duration of this menstrual phase will be 3 to 5 days. So first day of cycle is counted from the date of onset of menstruation. Now just see here. This is the endometrial diagram. Okay, this is representing the endometrium. On the top we have the changes which you see in the ovary. Now if you just closely observe, the lower half of this endometrium is slightly darker, right, when compared to the uppermost layer. So now remember, there are two layers in the endometrium. This is called endometrium, the stratum basale. The upper part is called stratum functional. So stratum basal and stratum functional. Stratum basal will not get sloughed during the menstrual cycle. Remember, it's only the functional layer which will be sloughed every month. So stratum basal, if you observe, the blue color and red color are the arteries, and also you can see some endometrial glands over here, right? So this first 5 days, if you see, the endometrial thickness is reducing because the whole all of this layer is coming off. The along with the cells, the blood vessel, the glands, blood vessel, the blood, everything is getting sloughed off, right? So at the end of fourth day or fifth day, if you see, the endometrium will be only having stratum basal layer. The functional layer is already gone. Now the stratum functional layer has to grow back. Clear? It has to start proliferating. All the glands, the blood vessels, everything has to proliferate, and the endometrial thickness will keep increasing. After ovulation, if you can observe, these are the endometrial glands. You can see here the endometrial glands are elongating, getting like longer and longer. But in the secretory phase, if you see, it will all be filled with secretions. That's why we call it as secretory phase. Hope you're getting the like idea about why do we call or why these phases have been named so. So stratum basal will not be sloughed, only stratum functional will be, it will be fallen during every menstrual cycle, you can see here. And from the stratum basal, the glands, the blood vessels will all start growing back or proliferating back. Clear? So just to go back here, menstrual or bleeding phase is nothing but the menstrual blood mainly consists of blood and sloughed endometrium. Clear? It usually lasts for about 5 days. Now, in the proliferative phase, now if you see 6th to 14th day, always remember the ovulation happens around roughly in a 28-day cycle, it happens on 14th day. So exactly half at the center of this 28-day cycle, you get your ovulation. Now, what exactly happens during the proliferative phases? It corresponds with the follicular phase in ovary. Now, moving back to the previous diagram, just see here, when the proliferation is happening, you can observe in the ovary, the follicles are also growing. Okay, that's why this is also called follicular phase. And remember, during this proliferation, the hormone which supports the proliferation is mainly estrogen. So, estrogen secreted from the developing ovarian follicle is what is responsible for thickening and proliferation of the endometrium. So, it is the hormone estrogen which is coming from this follicles is what is producing all this proliferation. And the blood vessels will grow back, endometrial glands will grow back. So, the endometrium which was very thin now becomes about comes to about 3 to 5 mm thickness. And the duration of proliferative phase can vary, okay? Even though I've written here 6th to 14th day, remember, for example, if it's a 28-day cycle, then it is fine, that 6th to 14th day. For example, if it is a 30-day cycle in a female, proliferative phase will keeps varying. The duration is not fixed, okay? Now, moving on to secretory phase, remember it corresponds with the luteal phase in ovary, meaning the follicles are converted into corpus luteum after ovulation. So that is why it's called a luteal phase. It almost corresponds with that. So when I tell a luteal phase, it means always remember I'm referring to ovary. At the same time, in the endometrium, which phase will be running? It is a secretory phase, is what is continuing in the endometrium. And the hormone responsible for this phase may mainly progesterone, because progesterone is secreted from the corpus luteum, and that causes increased vascularity and the endometrium thickens. So in the previous phase, proliferative phase, if you remember, the thickness of the endometrium was maximum around 3 to 5 mm. Now it will further increase by 1 mm. So about it becomes 5 mm to 6 mm thick endometrium. You can always like remember, because the glands and all are filled with secretions now, glands will become more and more coiled. It becomes secreted, they secrete mucus, and the arteries will become more and more spiral. They'll be very long and coiled and tortuous. So just observe the diagram here. During the menstrual phase, the stratum functional layer is getting sloughed off. So endometrial thickness, you can always assume like just 1 mm or something. So in the proliferative phase, it keeps growing back. It comes to around 3 to 5 mm, very close to ovulation. So after ovulation, what is happening? There's a further increase in the endometrial thickness because of all these glands are filled with secretions. And remember, proliferative phase is mainly because of estrogen. The hormone mainly responsible for secretory phase is progesterone. And you can see the glands here. Glands are getting elongated. Blood vessels are started growing back from the stratum basale. But as you come after ovulation, if you can observe, the blood vessels have become more and more coiled. Okay, that's why these arteries are called spiral arteries. And veins, if you see, they've all become like a sinuses. They'll be like filled with lot of blood. There'll be lot of secretions here. Now, the as I was mentioning initially, the menstrual cycle is mainly it is actually a preparation for the implantation, right? So you can see here, 14th day the ovum has been released, ovulation is happening. In case if it gets fertilized, what happens is that has to come and get implanted in the endometrium. By the time the implant the for the zygote to come to the endometrium, remember endometrium should be ready, right, with secretions and all. So that's why every month there is this preparation which is going on in the endometrium. So, menstrual phase, remember, if there is no fertilization, then the corpus luteum will degenerate and loss, and the hormones and all will not be there. Without estrogen and progesterone, what happens? The endometrium cannot survive. Okay, so that is why it results in menstruation. And also, spiral arteries are becoming more and more coiled, and that will lead to vasoconstriction. So that will lead to ischemia. There's a reduced blood supply to the endometrium, and that itself will lead to sloughing off of the endometrium. So there is no necrosis. So there is necrosis and sloughing of the endometrium resulting in bleeding. So here two main things what causes bleeding is, or why the endometrium is getting fallen off or sloughed off, is because one is there is no hormonal support. There's no estrogen or there's no progesterone. At the end of the menstrual cycle, remember, at the end of this cycle of 1 month, these hormones will reduce. That leads to sloughing off. Along with that, remember, vasoconstriction of the spiral artery is what leads to this. Endometrium is supplied by two types of arteries. Superficial two-thirds of the endometrium is shed during the menstruation, as I was mentioning, that is stratum functional, and that is supplied by long coiled spiral arteries. The deeper layer, that is the stratum basal, which is not shed during the menstrual cycle, it is supplied by short, straight basilar arteries. So corpus luteum disintegration is what leads to sudden withdrawal of progesterone that results in loss of stratum functionale. So the menstrual cycle lasts for about 3 to 5 days, and the volume of blood loss will usually range from 25 to 35 ml per menstrual cycle. Menstruation coincides with the early follicular phase of ovary. And why the stratum functional falls is because it is due to the two things which I already told us. The one is the spiral artery will because of repeated spiraling, it undergoes vasoconstriction and ischemia happens. At the same time, hormones will reduce, right? Other than that, at the endometrium level, what all happens is the main thing is there's a hydrolytic enzymes, okay, that will destroy the basal lamina of the endometrium. And also there is production of prostaglandin PGF2 alpha that will promote the contraction of the smooth muscles of the uterus and further the spiral arteries as well, which will lead to vasoconstriction and ischemia. So there is increased production of prostaglandin PGF2 alpha. So now we look into ovarian cycle. So you can see the follicles growing here. Initially, the germ cell will be surrounded by the outermost layer is the superficial or germinal epithelium. There will be formation of a primordial follicle. Many primordial follicles would be there that will be converted into a primary follicle, and there will be like antrum will form, and finally a proper Graafian follicle with the ovum would be there. So from the Graafian follicle now a mature ovum will come out. Once it comes out, no, there'll be some amount of blood which we can see. That's why we call it immediately after ovulation, which happens around 14th day. The ruptured follicle, we call it as corpus hemorrhagicum. After few days, if you can see, the follicular cells are getting converted into luteal cells, meaning these cells are laid with lot of lipid and cholesterol would be there. That's why this is called as corpus luteum cells, because it appears luteum meaning it's yellow color, okay? So it appears yellowish in like appearance. After that, this mature corpus luteum, if there is no further hormonal support, what happens is it undergoes corpus albicans. This happens mainly if there is no this fertilization. If there is no fertilization, if the first sperm entry is not there, ovum will fall off, and this corpus luteum will finally form corpus albicans. And finally, the hormonal support is lost. And remember, this corpus luteum is the one which mainly produces progesterone. So if you can see here, initial phase in the endometrium, there'll be bleeding. Okay, after that, the follicles will be growing. When the follicles are enlarging here in the ovary, in the endometrium, if you see in the uterus, in the endometrium, there'll be proliferative phase which will be happening. Okay, on 14th day, ovulation happens. After that, the luteal phase continues here. So in uterus, if you see, there'll be secretions which is happening, because once the ovum is released, by the time if the sperm enters and if the fertilization happens, then all this support will be hormonal support is actually provided by the corpus luteum. So if the fertilization happens, corpus luteum will get converted into what is called a corpus luteum of pregnancy, which will slightly increase in size, produces more hormones. Those are the changes what we saw till now are in endometrium and in the ovary. Now we'll see in the cervix what happens. Okay, the mucosa of the uterine cervix does not undergo cyclical desquamation, meaning, so when I was telling the endometrium layer is getting shed off. Okay, remember it is not the cervical layer will not be following. It's only the in the body of the endometrium these changes will be happening. Estrogen makes the mucus very thin and more alkaline, and these changes will promote the survival and transport of the sperms. Meaning, see, 14th day ovulation is happening, right? Around that, just prior to ovulation or around ovulation, what happens is the cervical mucus is very thin because of estrogen, and this will easily facilitate the sperm entry from vagina to cervix to the endometrium, because the fertilization will happen only in the ampulla, in the fallopian tube, right? So the sperm has to travel up along the female genital tract, so that is facilitated by estrogen. But after ovulation, we don't want further sperm entry, right? So after ovulation, remember, under the influence of progesterone, the cervical mucus will become very thick. It becomes tenacious and more cellular. So the mucus becomes thinnest at the time of ovulation, and its elasticity, or it's called as pin bucket appearance. Okay, if you can take the cervical mucus between the two fingers and you just try to stretch it, okay, it will stretch up to 8 to 10 centimeter or more in length, and that is called as pin bucket appearance. And that is nothing but the mucus is very thin because of the influence of estrogen. So mucus will dry in arborizing fern-like pattern when a thin layer is spread on the slide. So after ovulation and during pregnancy, remember the mucus becomes thick and the fern-like pattern is lost. So we'll just see here. This is on the 14th day of menstruation. Like in a normal cycle, remember 14th day ovulation happens. What has happened? The fern-like pattern has disappeared. So in the during the luteal phase, if you see mid luteal phase, again there is no fern-like pattern. But if a female is not ovulating, okay, one of the tests what they do is They take the cervical mucus, spread it on a glass slide and stain it. So if you can see fern like pattern, like a green grass kind of pattern, then it means still estrogen is very high. This fern like pattern is seen under the influence of estrogen. Estrogen we see during which phase? In the proliferative phase. After ovulation, what should have happened? Progesterone should have been produced, and progesterone will lead to like dissolution of this fern like pattern. So, if a female, somewhere around you take 14th day ovulation has happened, you assume the ovulation is happening. So, somewhere around 20th or 22nd day, just take a cervical sample, mucus sample, and you do this a slide. You make a slide and you see what is the mucus pattern. If the mucus is still showing this fern-like pattern, it means the lady is having what is called an ovulatory cycle. The cyclical changes are there, but ovulation is not happening, because once ovulation happens, progesterone should have come and all the fern-like pattern should be lost. So in a normal female, remember, prior to 14th day, if you take a cervical sample, it will show fern-like pattern, but after ovulation, the fern-like pattern will be lost. So just this is a spin bucket appearance what I was telling. If you take the cervical mucus and stretch it in between the fingers, it will be stretched up to 8 to 10 centimeter, and this is called as spin bucket appearance. So fern-like pattern I already explained before. And if you observe the vagina, what changes here is seen under the influence of estrogen, meaning I'm talking about proliferative phase here. Vaginal epithelium becomes cornified, and these cornified epithelial cells can be identified when you make a vaginal smear. But under the once the ovulation happens, under the influence of progesterone, a thick mucus is secreted in the vagina, and the epithelium will proliferate, and that again will be infiltrated with WBCs, leukocytes. So if you see a leukocytes in the vaginal epithelium, it indicates ovulation has already happened. So cyclical changes in the mammary gland. What happens during the menstrual cycle is, always remember, uh, in the breast there is a duct and there are lobules or alveoli. Meaning these alveoli and lobules are the one which will actually produce milk, and that will be conducted via the ducts, right? So estrogen. So throughout the menstrual cycle, now remember, very beautifully, what will be happening is estrogen will help in the proliferation of the duct. So the first half of the menstrual cycle, mainly the ducts will be developing. In the second half of the menstrual cycle, the alveoli and the lobules are the one, the cells are the one which will actually produce the milk. No, they will be growing. So the and the breast swelling, tenderness, and pain experienced by many women during the 10 days preceding menstruation is probably due to distension of the ducts, hyperemia, edema of the breast. And this is seen under the influence of progesterone. Okay, so immediately once the menstrual cycle starts, now when the hormones come down, all the tenderness in the mammary gland also will reduce. So all these changes regress along with the symptoms during menstruation. So basal body temperature is another test. This is again indicates the time of ovulation, because immediately after ovulation there is a small rise in body temperature. So the rise starts 1 to 2 days after ovulation, or sometimes what they tell is the next day itself there is a zero point 0.5 degree increase in the body temperature. So women should measure the temperature in the morning before getting out of the bed, even before brushing, even before the female comes out of the bed. No, she should record her oral temperature and see what is the every day note down the temperature. Okay, when there is an increase in the body temperature by zero point 0.5 degrees centigrade, it indicates that the previous day she has had her ovulation. So the cause of this temperature change at the time of ovulation is probably because of the increase in the progesterone hormone, because progesterone increases body temperature. That's why we call it as thermogenic hormone. So you can observe here the body temperature regularly measured here. At the time of ovulation, after ovulation, you see previously there's a slight drop, followed by that there is increase in the body temperature by zero point 0.5 degrees centigrade throughout the secretory phase because of the influence of progesterone. Hormones which influence the menstrual cycle are: from the hypothalamus, GnRH hormone is released, which will act on pituitary gland to produce LH and FSH, that will act on theca interna and granulosa cells in the ovary, and that will produce estrogen. Clear? Remember, just remember, hypothalamo pituitary ovarian axis is what regulates the menstrual cycle. And to understand the complexity of the hormonal changes, it again needs a separate video. I'll do it in the another video, only the hormonal changes seen during the menstrual cycle. So all this I'll explain in the next video. So now just to summarize the changes which happen during the menstrual cycle. Okay, one is the uterine changes, the menstrual phase, proliferative phase and secretory phase. Hormonal changes, if you observe estrogen and progesterone, mainly estrogen predominates during the proliferative phase and progesterone predominates in the uh, luteal phase. And in the ovary you can see the follicles are growing. 14th day ovulation happens. This is your follicular phase prior to the ovulation. After ovulation we call it as luteal phase. And basal body temperature, as I mentioned, under the influence of estrogen, temperature will be less, but because of progesterone, because of its thermogenic action, the body temperature increases after menstruation. So what are the tests to detect ovulation? One is you can identify basal body temperature. You can also study the cervical mucus test, spin bucket and Fern test. You can do endometrial biopsy and see whether the secretory phase is there or the proliferative phase is there. Because during proliferative phase, it means there is no ovulation, right? Only after ovulation the secretory phase starts. You can do ultrasound and see the ovum, all that you can observe. They can observe the ovary and endometrial changes. Vaginal cytology, WBCs would be there after the ovulation. Hormonal assay you can do, endoscopy also you can do. Again, this also no, the I'll detail in detail. I'll explain the test for ovulation in a separate video. Some abnormalities of menstrual cycle are like absence of a menstrual bleeding. We call it as amenorrhea, meaning a lady has never got her menstruation. A female has not at all got her menarche, not attained menarche. Then we call it as primary amenorrhea, right? Secondary amenorrhea meaning a female was regularly getting her cycles, but for some reason now the cycles have stopped. Okay, it can be any reason. One of the normal physiological cause I could tell is pregnancy, because throughout the pregnancy 9 months the menstruation will not happen. Okay, it's a kind of amenorrhea because absence of menstrual bleeding, right? So primary amenorrhea meaning she has not never occurred, the bleeding has never occurred, meaning she has not attained menarche. That usually happens in genetic disorders like Turner syndrome. Secondary amenorrhea happens during pregnancy and some other abnormal conditions also we get it. Polymenorrhea meaning increased frequency. Oligomenorrhea is decreased frequency. Metorrhagia is bleeding occurring in between menstruation, somewhere around ovulation and all. If you get some bleeding on 14th day, 15th day and all, or any other day other than the menstrual phase, we call it as metorrhagia.